My name is Amia Turner, and I done my presentation on the Tay-Sachs disease. This disease is a rare disease and is passed down from the parent to the child. And the parent does not necessarily have to have symptoms of the disease, but the parent is labeled as a carrier. And this is how the child gets Tay-Sachs disease. And it stops the nerves from functioning properly. What is Tay-Sachs disease? Tay-Sachs disease is a genetic disorder that is caused by ganglioside, a fatty substance building up in the brain and the spinal cord, and this results in the nerves not functioning properly. How is Tay-Sachs disease caused? Like I mentioned earlier, Tay-Sachs disease is a problem in the child's genes, so it is passed down from the parents. So the child can only have Tay-Sachs disease if both parents carry this faulty gene. Symptoms usually don't start to occur until the infant is 3 to 6 months, and survival is only a few years. And some of the symptoms include hearing loss, movement loss, seizures, cherry red spots in the eyes, and exaggerated startle response when the baby hears a loud noise. Who can catch Tay-Sachs disease? It only affects a certain amount of the population, and it's usually the Jewish population. And some other population that it affects is French Canadian community in Quebec, communities in Louisiana, and communities in Pennsylvania. While there is no specific cure for Tay-Sachs disease, there's medicine that can be given to the child to stop the seizures and to reduce the symptoms before getting to Tay-Sachs disease. And you should always give the child proper nutrition and stay hydrated to, reduce the symptoms to getting to Tay-Sachs disease. You should always see a doctor if you notice that your child has any of these signs or symptoms, or if you are concerned about the child's development and, could think that it could result to this Tay-Sachs disease. 2 facts that I learned about Tay-Sachs disease is that Tay-Sachs disease is usually found in babies, but it is now found in adults too, in their 20s to 30s. And their symptoms are totally different from where the babies. The only symptom that they have in common is the cherry spots in their eyes. And in adults, they usually lose their balance and they deteriorate as they, progress in this disease. The second fact is, as I mentioned before, hearing loss and vision loss is bound to happen. But muscle loss is too, and the muscles start to seize up. So when you have Tay-Sachs disease, dementia starts to set in early for the children, and it becomes hard for them to swallow, to even eat and get the nutrients. So that is why most children do not survive Tay-Sachs disease. To conclude, seeing a child with this kind of disease and knowing that you can't be there for them, you can be there for them, but knowing that you can't do anything to prevent this from causing death or, loss of their movement or abilities, is hard. So continue to love the child for who they are, because the disease does not make the child.